was diagnosed with Crohn's disease in 1997. I started having a lot of bowel movements and high fevers. I should mention that before I was diagnosed with Crohn's, I weighed 220 pounds. And I progressively lost a tremendous amount of weight the first year specifically. I was down to 90 pounds, had severe osteoporosis, had a fractured spine.
Her quality of life was really awful. I mean, she was suffering from abdominal pain, from cramps, poor appetite, weight loss, diarrhea.
IBD, including Crohn's and colitis, are diseases that strike the intestine. In the case of Crohn's, they can hit any part of your intestine, literally from your mouth all the way down to your bottom. And ulcerative colitis is something that affects the last 4 to 6 feet, the colon and the rectum. These are diseases where an inflammation occurs in the body in those areas.
It can present with various symptoms, including abdominal pain, joint pains, skin rashes. It could be a very disabling condition depending on the extent of the gastrointestinal tract involved and how severe the inflammation is.
The cause of IBD is still somewhat unknown.
It is estimated probably between 1.5 and 2 million people in the United States are affected by Crohn's disease.
As a teacher, I would worry about who's going to cover my kids that have to run out of the room to go to the bathroom. Or can I go out to a restaurant because how many times am I going to get up to go to the bathroom? It's heavy, but I need your help. As a person who has Crohn's, you become very anxious about going places. I would get up in the morning, I'd force myself to get dressed and go to work. I did it because I loved my job, I loved teaching. But it was getting very, very difficult. I was very, very weak. And sometimes there would be days that would go by where I would just be in bed and I felt like life was passing me by and I was just watching it.
Christina has a complicated manifestation of Crohn's disease.
Her biggest issue was that she kept developing these strictures, high pressure areas in the intestine, which would then result in fistula, little openings from the intestinal lumen into other adjacent organs or even to the external world through the skin.
The reason why I chose to see Dr. Melsom to begin with at Weill Cornell was because they pioneer a procedure called Strictureplasty, which saves the bowel.
Pretty much there are two kinds of surgeries that you can perform. One is a bowel resection, where you take out the disease segment and hopefully you put together the two ends of the intestine so that the gastrointestinal continuity is maintained. The other way is to perform bowel-sparing procedures, also known as strictureplasties. And strictureplasties have the great advantage of taking care of the complications of the Crohn's disease, most often the obstructive complications of Crohn's disease, without resecting any bowel.
We use the latest techniques to give her a chance to recover quickly with a small incision.
We did a Strictureplasty, which was the best thing I had ever done.
After strictureplasty procedures, the recurrence of Crohn's disease seems to be much less than the recurrence that we expect after a resection.
In order to now keep her under control, we have to keep her on medications and watch her pretty closely.
Oh, look at the big one. I'm feeling really well. I'm gaining weight. I'm able to have an active life without having to worry about the disease coming back right now. And for all intents and purposes, I feel as if I'm in full remission because I feel very healthy.
I feel very optimistic about her care here, and I think she's got an excellent prognosis. I think she's going to be able to have a full life and do whatever she wants to do.
My biggest concern was who would take care of my son. What would happen to him? So the fact that these procedures are available to patients now, where they weren't available when I was first diagnosed, and it hasn't been very long since I was first diagnosed, to me is a huge, huge advance in medicine. And I'm grateful to every researcher who does the research. I'm grateful to every doctor who is open to giving these options to patients.
There's really no greater feeling when a patient comes back in to see you after you've treated them and they're feeling great.
A cure is possible in my lifetime for inflammatory bowel disease, okay? That's a big goal, but if you don't think big, it's not likely you're going to get there.